Hi, I'm back again. Saying, I just wanted to let everybody know that um, change is coming, and a lot of people have been, I'm sure, aware that the news has been covering a lot of things about opiate and heroin, and the law that changed October 1st as um, it was hospitalization for up to 14 days for someone that needed the help and that it's their choice. Um, but the hospital can't let them go onto the streets again. At this point, they're supposed to hold them and find a place. A lot of people are out there bringing these people to hospitals, being their advocate and letting them know what these changes really are. I am not familiar with all of them, so I don't want to be responsible for all of them. I know there is going to be more coming out soon. But I am here to tell you that we are in town. Oxford's working on getting an organization in here, Heroin's Killing My Town, along with other resources, um, officials, and have some knock-in training. So I just want to ensure you all that things are going to change, and if you do need help, reach out and find someone. There's many people out there, like I have said. There's so many resources. I keep finding and finding and finding more and more and more. And also alternative medicine for heroin is actually for withdrawal symptoms. Like I'm not a professional at this, but there is ways that you can ask your doctor to help get down with something you may have found online as far as to help without medicating yourself if that's the way you want to go. And I know there's many things out there that help with that. And I know in my last video I did talk about natural remedies, only because that's the way I feel. I don't want a world full of people taking more pills and more pills and more pills. I know they help with a lot of things, but it's not good for a lot of things. Also, there's so many natural things out there. It's a shame that we don't know that. And I just hope that people, look into other ways in alternative medicines. I just hope this is brought to attention that this should be looked at also. And I haven't really spoke to do too much with people about this. That I think the healthcare should be leaning more towards the health of people, the healthy ways, such as how we've come a long way with technology, which is fine. But at this point, the foods really aren't as good as they are anymore. There's so many things that are bad for you, and we need to like flush our bodies with even just the toxins from the food. I mean, I don't mean to scare anybody, but I mean it's just we need to watch what we eat even at this point. And this really, this epidemic and this being a health issue, I just think that this should be brought up. That's no good for us. Heroin's no good for us. So also a lot of things that are in this world that aren't good for us should be looked at also on the other side of the scale. As far as even taking that medicine in the first place. Um, so I'm reaching out just to let you guys know that there is going to be a meeting, which I already said, and to think about that, about alternative medicines and what we can do for our children in the future. To go back to the garden and plant a garden, plant an herb garden, plant your spices. I did this year, and I enjoyed it a lot. I had a lot of fun. I'm learning as I go, and there's so many people that do want to learn, and I am lucky enough to be able to do that. So, and I hope I can inspire somebody else to do that also. And that's all for tonight. Have a good night. God bless. Take care. Bye bye.